Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. The National Primary Healthcare Development Agency launches disease checking strategy in Abuja. Former Defense Minister General Theophilus Danjuma advocates use of local languages to promote COVID-19 awareness. And Brazil's Biomedical Center partners Oxford AstraZeneca to produce homemade vaccine for rollout. Thank you for joining us. The World Health Organization says the number of new coronavirus cases around the world fell by 21% in the past week. In its weekly pandemic report, WHO said there were more than 12 million new COVID-19 infections in the last 7 days. The number of new COVID-19 deaths also fell 8% to about 67,000 worldwide, the first time that weekly deaths have fallen since early January. The Western Pacific was the only region that saw an increase in COVID-19 cases with a 29% jump, while the number of infections elsewhere dropped significantly. While the highest number of new COVID-19 cases were in Russia, Germany, Brazil, the US and South Korea, Nigeria last night recorded only 27 cases across the country. Here's more on the pandemic update.
27 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 4 states and the FCT and indicate a drop from the figures reported earlier. Lagos had the most cases with 12 reported infections, followed by the FCT, which had 8 cases. Katsina came in with 5 cases, while Kano and Rivers had 1 case each. Nigeria now has a cumulative caseload of 254,352. No cases were reported from 2 states, Sokoto and Cross River. 53 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 230,846. There were no additional deaths recorded in the last 24 hours, leaving the fatality toll at 3,141. Currently, there are over 20,000 active cases in Nigeria, while more than 4.3 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission with over 17,000 active infections, followed by Benue and Kwara states. More than 17 million Nigerians of eligible age, representing 15.4% of the target population, have received 1 dose of the COVID-19 vaccine.
According to the National Primary Healthcare Development Agency, Nigeria is expecting at least 48 million doses of COVID-19 vaccines before the end of 2022. At the relaunch of Phase 3 COVID-19 vaccine rollout tagged Scales 2.0 strategy and the launch of the vaccination site finder app in Abuja, the executive director of the agency, Dr. Faisal Shuaib, says Nigeria currently vaccinates 200,000 people per day, and that for the nation to hit the target of reaching 70% of its eligible population before the end of this year, the number has to increase. Our correspondent, Emperor Simon, reports.
COVID-19 vaccination still remains a challenge in Nigeria, and that's the reason for this meeting. The National Primary Healthcare Development Agency, in collaboration with the Federal Ministry of Health and the United Nations Children Fund, UNICEF, is launching a strategy codenamed Scales 2.0 to ensure effective distribution of COVID-19 vaccines.
We're vaccinating at over 200,000, just a little over 200,000 people per day. But for us to be able to reach our target of reaching 70% of eligible populations before the end of 2022, we have to hit 550,000 people per day. That means more than doubling the number of people that we're vaccinating. Today, we're also going to be launching the single-shot vaccine for everyone, the Johnson & Johnson vaccine. We know that the opportunity to have that single shot, not only in the hardest to reach areas, but everybody having access to one single shot will definitely increase our coverage for COVID-19 vaccination.
Available data from the National Primary Healthcare Development Agency shows that as at February 20, 2022, over 17 million people, representing 15.3% of the population, have received first dose of COVID-19 vaccines. Over 7.5 million people, representing 6.7%, have received second dose, and over 650,000 people have been given booster doses. Stakeholders call for all hands to be on deck.
We must realize that all people need to be aware of the problem of COVID-19, and all people need to protect themselves as well as protect their communities, as well as protect the country as a whole.
We believe that in order to succeed and achieve the targets, state-level ownership, mutual accountability, and political will at state level are key.
This new strategy hopefully will increase access to COVID-19 vaccines and also tackle the challenge of vaccine hesitancy in Nigeria. Emperor Simon, Channels Television News.
A former Defence Minister, General Theophilus Danjuma, has expressed concern of the dangers of community transmission of COVID-19 in Taraba State. Speaking at an event in Takum local government area, he advised residents to get vaccinated, advocating for the use of local languages to improve awareness on COVID-19.
Since the outbreak of COVID-19 in the country, states have continued to deploy measures to flatten the curve, including ramping up sensitization efforts, especially for those in rural communities. The commissioning of the Jukun Bible Institute in Takum local government area of Taraba State is a project aimed at enhancing the translation of the Holy Bible into Jukun language. However, the former Minister of Defense is using the occasion to advocate the use of local languages to communicate preventive measures and promote more awareness about COVID-19. He's also reminding residents not to lower their guards as the country is not out of the woods.
Somehow, we have been lucky in Taraba, at least from the official report that I read on the television, that the dying, the killings from the pandemic here in this state is about the least. We thank God for that.
International organizations are also present at the occasion. They commend the state government's response in preventing the further spread of the virus.
The fight against COVID-19 is ongoing, but we thank God that for Nigeria and Taraba State in particular, it's a winning battle. Taraba State, by the special grace of God, actually has one of the lowest rates of death and serious illness from COVID-19.
The chairman of Takum local government area says the ongoing mass vaccination exercise has been a success so far. He attributes this to sensitization efforts by the state government to increase vaccine uptake among residents.
We call for town hall meetings, all the 11 council wards in Takum. That is what we did, and people complied. And in fact, many of them have taken, they are even asking for more. We say, okay, they should wait to see or to hear what the government will say.
The use of local languages and raising awareness on COVID-19 is expected to be implemented across the 40 tribes in Taraba State to enhance the public's understanding on coronavirus and encourage prescribed preventive measures.
Nigeria is signatory of the International Health Regulation IHR, which is mandated to report IHR compliance on a set of key benchmarks. To accelerate Nigeria's progress to achieving this objective formed the crux of a brainstorming session on health preparedness for media practitioners and strengthening risk communication. Take a look. The role of the media in tackling the outbreak of infectious diseases in Nigeria cannot be overemphasized.
Specific question is understanding that media has many channels.
This informs this workshop organised by the Nigeria Centre for Disease Control, USAID, Breakthrough Action and other partners in Lagos.
For us to have a safe public health space, we need that collaboration. And one of the ways in which we can disseminate health information is actually through the media. So coming up with this idea with NCDC to actually build the capacity of journalists and editors on health reporting, it's a very good one, because we know that we need that collaboration to pass across correct information and accurate information to the public.
According to the experts, the socio-demographics of Nigeria predisposes the country to infection, some of which include the annual population growth rate of 2.6%, annual disease outbreak like meningitis, monkeypox, Lassa fever and others, coupled with the low expenditure on health.
For us in Nigeria, we've had a lot of these infectious diseases over time. Remember the Ebola virus disease, though that was transmitted from man. We also have Lassa fever that comes from rodents to humans. It was an emerging infectious disease, then became a reimagined one, and then currently it is endemic. We've had other infections. You have brucellosis, you have anthrax. These are all pathogens that ordinarily shouldn't afflict man, but has been able to move from animals to man.
Dr. Chu also sees previous infectious diseases as indirectly preparing Nigeria for Covid-19. She nonetheless calls for observance of all safety protocols in spite of the low case numbers being recorded at the moment.
Covid-19 remains a threat because of the emergence of variants of concern. Now, that is another emerging disease problem that we have, because even the Covid-19 that we know could become another variant that we don't know in the near future. Most times, these variants of concern are driven by all these lack of adherence to public health and social measures. So we are seeing smaller numbers, but that might not necessarily mean that we are not exposed. And the current seroprevalence studies that we're doing, collecting blood samples to test for antibodies against COVID-19, will give us a better picture of the burden of COVID-19 in Nigeria. So for now, we continue to advise the public to adhere to public health and social measures.
The platform hopes for stronger collaboration among the media, government and other partners in capacity building. Well, still to come on the program, we have more from the international community on how they are handling the pandemic. Please stay with us. Welcome back. In the city of Chicago, officials are monitoring 4 key metrics when it comes to deciding to roll back the mandates: COVID cases, positivity rates, hospital admissions, and ICU COVID patient census data. Now, 3 of those 4 metrics were required to be at a lower transmission factor by CDC guidelines, and the latter 3 metrics are all within that range at this time. While COVID cases are still at a substantial transmission factor, cases have fallen in Chicago by 37% in the last week, dropping to 283 as of Monday. Well, joining us for more on the situation in the United States is Dr. Damilola Adeyemi, is the Medical Director, Antimicrobial Stewardship Program, Swedish Hospital, North Shore University, Chicago. Thank you for joining us on the program.
Thank you for having me.
Now, Doctor, what does the data say about where the U.S. is going in the pandemic?
Well, so the number of cases has, dramatically reduced from when we had a surge in the middle of January last year. So cases have, in general, in the United States, have come down by over 80%. Hospital admissions are going down as well. ICU, number of patients in the ICU are reducing as well. And the death rates is beginning to go down as well. So we're moving in the right direction at this time. in the United States.
Are you happy with it? Because, I mean, the method in the US is pretty much being criticized compared to perhaps some other parts of the world, the UK, also Europe. And then we also have those who have said, you know, they don't believe in the vaccines. Do you think that, you know, the US is right now on the right track?
Yeah, I think the U.S. is on the right track, but we could do better. Overall, in the country, about 65% of people have been vaccinated. The data is clear. The data is very clear that this vaccine helps. This vaccine prevents severe illness, and it also prevents hospitalization and death in people who are vaccinated. There's the CDC data that came out last month that showed that amongst people who are 65 and older, the death rate amongst people who are boosted versus people who are not vaccinated is reduced by almost 90. The number is actually 88 times lower in people who are boosted. So we know that the data is clear. There's no basis for argument about that. But there are a lot of things that come into play with this. So people are still getting exposed. Even though I told you earlier that the number of cases is it's gone down, it's nosedive down. We are still having over, quite a number of cases every day being reported, and our death rate is still like, almost 2,000 daily. So there's still some work to be done, but I believe we're heading in the right direction. It's just we need more people to get vaccinated and people to just follow all those mitigation strategies that we talk about. And if for people who've been vaccinated, to get the booster shot, because we know for older people, the booster really helps.
Dr. Adeyemi, tell us a bit about your experience. You traveled to Nigeria and back to the US during the years of the pandemic. What have you noticed about both countries under the pandemic?
Yes, thanks. So I just left. I was in Nigeria about a week. Yeah, I left on the 13th to come back home, and I was in Nigeria for about 6 days. So I would say it depends on where you go to. So it was a mixed feeling. On landing at the airport, a lot of people were wearing their masks. People were sort of distancing as much as they could. So I was impressed. I mean, it was not crowded. Like I said, it depends on where you go to. So there were some centers that I went to where you couldn't enter if you didn't have a mask on. And there were places where I went to where there was really nobody wearing the mask. It was, everybody was just going about their daily activities. So that was a little scary. People were going about their normal duties. So it depends on where you go to back in Nigeria. And it's really interesting and puzzling, that the way the pandemic hit the US, we've been very lucky in Nigeria that we've not had that kind of impact.
And even for the African continent, which a lot of scientists are still trying to discover exactly what could be responsible. But then what would you say is an unforgettable experience as a doctor under the pandemic?
Oh, unforgettable experience is seeing young people who have a bright future, who just refuse to take the vaccine, get infected, and then die. That is heartbreaking, is what I would say. Those are, preventable deaths. Seeing people dying when it could be prevented it's heartbreaking, is what I would say. That toll, there's a toll on, frontline workers, nurses, respiratory therapists, nursing assistants in the hospital. Everybody is having a toll of this disease. It's like the number of cases when we're in the surge now, everything is relaxed and cases have come down. We're still having cases, but when the Omicron came and there was the surge, end of December, beginning till the middle of January, till mid-January, basically, it took a toll on frontline workers, just like throughout the pandemic as well. So what I would always take with me is the fact that there were a lot of people whose death could have been prevented just by taking the vaccine. Now, there was a time we didn't have the vaccine. So, you couldn't really say much about, you couldn't blame those people that were just a little bit unlucky or they had other medical conditions that put them at high risk. But since we've had the vaccine and there's clear data that shows that these vaccines, not just one, prevent severe illness, hospitalization, and death. I think it's a no-brainer to be vaccinated at this time. It's a no-brainer to be vaccinated and boosted if you're eligible.
Some experts have said perhaps infodemics is the cause of that, and that can also be attributed to the questions surrounding the origin of COVID-19 and the conspiracy theories following that.
Sorry, what did you say was the conspiracy theory about what?
So, I mean, based on from what you've said now, experts put it under infodemics that is spread all around COVID-19. And this also is where you talk about the origins of COVID. Where did it come from? How did it come into Wuhan? Who exactly brought it? And then the conspiracy theories around that subject, because many people are still questioning the definitive evidence before the world as to, the origins of COVID-19.
Yes. Well, we right now, scientifically, we believe it came out from Wuhan and came out, and that's the belief right now. But all these other conspiracy theories that you're talking about, we have a pandemic at hand, and the most important thing is to save lives, to prevent people from dying, and so we can deal with that. And I'm sure that if there's any doubt about if there was anything fishy about the origin of this virus, we'll get to know eventually. But the most important thing now is to prevent people from dying, and that's what we want to do.
We appreciate your time. Dr. Damilola Adeyemi is the Medical Director, Antimicrobial Stewardship Program, Swedish Hospital, North Shore University, Chicago. Many thanks for joining us at this time.
Thank you for having me.
Staying in the United States, they've announced the deployment of hundreds of unarmed National Guard troops to Washington ahead of the arrival of trucker convoys protesting against pandemic restrictions. Defense Secretary approved the request from the District of Columbia government and the U.S. Capitol Police. The roughly 700 troops will be deployed on various roads in Washington. Here's more on the global update.
Inspired by their Canadian counterparts, U.S. truck drivers began gathering in Adelanto, California on Tuesday to form a protest convoy of drivers bound for Washington, D.C. Calling themselves the People's Convoy, the truckers plan to set off on Wednesday morning and drive more than 4,000 kilometers to Washington, D.C. to protest coronavirus restrictions and mask mandates.
I mean, what we're looking for is to end the declaration of emergency, the emergency declaration, to end the mandates on the vaccine and the mask mandates, especially for our healthcare workers, our law enforcement officers, our federal employees, and of course, our military personnel. It's about having the choice.
Brazilian Biomedical Center Fiocruz has produced homemade COVID-19 vaccines for the South American country as part of partnership with Oxford AstraZeneca. The first locally made vials were handed to authorities earlier this month and will form part of the country's vaccine rollout. Brazil's health ministry reported on Tuesday 105,776 new cases of the novel coronavirus in the past 24 hours. And 816 deaths from COVID-19. South Korea's health authorities say they are changing the COVID-19 quarantine framework from a stance of suppressing confirmed cases to an approach of minimizing serious cases. Deaths have slowly ticked up, reaching a near-record high of 99 on Tuesday, but South Korean authorities say real-world data shows people infected with Omicron coronavirus variant are nearly 75% less likely to develop serious illness or die than those who contract the Delta variant. Cambodia has started vaccinating children as young as 3 years old against COVID-19, making it one of the first countries to cover under 5 age group in a push to cover its entire population of 16 million. The inoculation drive for toddlers started in the capital city. Hundreds of people queued outside clinics where medical staff in personal protection gear administered the vaccines to teary-eyed or wailing children. The Southeast Asian country has vaccinated over 90% of its population, among the highest rates in the region.
Well, ChannelsTV.com has more updates, also a better understanding of the pandemic. You can catch breaking news and other stories at your fingertips. That's our program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.